NCLEXRN and NCLEX PN both got updated on 1st April 2026. If you are planning to take NCLEX after April 2026, this would affect you. You do not need to be scared because I am going to be preparing you for this. In the next few minutes in this video, I am going to do a quick fact guide on what stays the same, what is changing, and how it is going to affect your preparation so that you feel confident. Remember, NCLEX is a safe and safety exam that makes sure the way you study and answer questions prove that you are a safe nurse. Let's get started. Very first, what stays the same in NCLEX after April 2026? There are two major things which will stay same. First is time limit and second is structure. You will still get up to 5 hours in total, and yes, that includes your tutorial and any breaks you take. Major tip is the clock keeps running during your break, so space yourself. And second is the question range. For both RN and PN, the minimum is 85 questions and the maximum is 150. That is, question count stays exactly the same. Now, what does this mean? This means as soon as you answer question number 85, the computer adapting testing algorithm, that is CAT, actively begins to calculate your performance to determine if you are pass or if you are fail. Furthermore, clinical judgment model is still the anchor of this exam. If you have been grinding away at a bow tie questions, matrix questions, and case studies, breathe easy. Your hard work is money in the bank. The patient needs, categories, and scoring methods aren't moving an inch. It's the same blueprint and same ultimate mission. Play it safe and prove that you can handle hit on the floor. So what is really changing? Let's cut to the chase. Is the 2026 NCLEX changing? The answer is yes, but it's not turning into a monster. This update is about polishing the edges and not moving the goalpost. There are no brand new subjects thrown at you, and they aren't turning the difficult dial up to 11. Think evolution, not revolution. The first is clinical judgment in the gray areas. You are going to see more scenarios where the data is up in the air or shifting under your feet. You will have to read between the lines and make a call, even if every choice on the screen looks like a winner. It's all about your context and over textbook rules. Computer love to test your internal compass on the classic dilemma. Do I hold steady or I pull the trigger right now? You know the drill. Those with high stakes, what do you do first and prioritize answer? You may expect incomplete data. You will have to rely on context over rigid theory and not just memorized rules. Here is another pattern to keep you on radar. Multi-patient case studies that unfold in real time. You are stuck between rock and a hard place, and when every answer looks correct, what action will keep my patient breathing? And what prevents crash in future? At the end, at the end of the day, NCLEX is a safety and a simple test. Keep that North Star in sight and you'll do great. Again, the golden rule is every answer will look like a winner. Look for the choices to stop the further crash. Safety isn't just a metric, it's your North Star to follow. In real world juggling, you know that you could be caring up to 4 patients or more simultaneously. Because real nursing never happens in vacuum. That is, you will rarely get 1:1, 1:2, such kind of patients. The exam blueprints are getting facelift. To keep up with the time, we are talking about a major focus on delivering unbiased, fair square, equitable, across board, no matter what is patient's orientation, gender identity, and gender expression is. They are also tightening screws on patient confidentiality, which means you need to know the rules of the road for smart and safe social media use. Now, don't think they forgot the basics. Safety, infection control, hygiene control are still bread and butter of this test, on which they will be testing you heavily. Finally, they have fine-tuned the physiological adaptation section. Expect to see questions on tracking and troubleshoot advanced internal monitoring devices, the kind of high-stakes stuff that is in a standard operating procedure in today's acute and critical care standards. But let's get one thing straight so that you can sleep easy tonight. These are just fine tunings and clarifications. The computer isn't throwing a curveball with a brand new anatomy, wild physiology, and reinventing pharmacology. You still need to lock down your fundamentals, know your lab values like a back of your hand, understand core disease process, and master triage prioritizing. No need to rewrite the playbook. Just sharpen your current tools. The computer will also check on language and expectations. At the end of the day, the NCLEX just want to see that you won't be loose cannon on the floor. Because of that, botai questions, matrix question, and standalone items are still part and parcel of the exam. Case study also remain front and center, but they are turning up the heat on spot trends and triage across whole floor of the patient. Let's talk about scoring approach. If question hits you with scenario where you are completely flying blind, meaning you have zero lab results yet, what should be the nurse's plan? You need to zero in on the choice that plays it closest to the safe and keep the patient out of danger zone. Don't let it throw you for a loop. Hunt for keywords and rely on context. Choose path of safe prioritization to prevent immediate harm. Your bread and butter here is safe and timely action. To make it second nature, let's lock down SAFE acronym. S stands for scan clues. What is immediate threat to the life, airway or limb or circulation? Stands on act on threat like emergency alarms, crash cart, intervention or even escalation. F stands for follow up, find safe way, deep digger once stable, grab those lab, imaging and do reassessments. E stands for evaluate. Did your actions successfully move the needle and reduced the risk? When looking at any scenario, always ask yourself multiple questions or interrogate yourself. Which clues would actually move the needle? If I step in, what danger am I taking off the patient? And at what point do I need to sound alarm and escalate this up to the chain of command? You got to have flex your context muscles, not just blind a massive bank of textbook facts. Now don't get me wrong, knowing your content is still a major piece of puzzle, but you need to test yourself loud out to bridge the gap. Literally say it loud, if I select this answer, what would be my patient's reality in 10 minutes down the line? Or ask yourself, am I just kicking the can down the road, delaying the care, or am I actively keeping this patient out of danger zone? This is the golden advice. If you find stuck between two answers that both look similar, you either are not prepared or your concepts are not clear. Always pick the option that saves patient life immediately or put patient out of danger. At the end of the day, your main objective is to neutralize that instant threat, and believe me, you will dominate this exam. Other point is safety and the basics. Language of safety. Whenever you are weighing your options, always remember your choice back to your basics of nursing. That is your ABCDE approach. Always anchor your answers to airway, breathing, circulation, disability, exposure, and etc. Play detective and ask yourself, what answer is actively trying to remove risk? Look out for heavy bleeding, acute neurological shift, perfusion threats, and even breakdown in infection control. If it poses a threat to your patient, it needs to be on your radar. Make sure you are chaining every single intervention straight to the clinical judgment model. That means you are continuously cycling through core steps. That is, recognizing clues, analyzing data, prioritizing hypotheses, taking actions, and even evaluating care. Finally, keep your fundamentals razor sharp. Don't get so caught up in complex case studies that you lose your grip on the basics. You still need to know your standard lab values like back of your hand. Look into your isolation precautions, master your lab values, prioritize your medical surgical interventions, and keep your core pharmacology basics polished. Keep your foundation solid and the rest will fall into place. The most lethal conditions are the one that center stage of this exam, because at its core, this is a safety check. That means heavy hitters like hypoxia, sepsis, hypoglycemia, and major hemorrhage are going to be the bread and butter of your test questions. Now let's dive into quick question and answer to clear up confusion between NCLEXRN and PN changes. Both tracks are transitioning to the new April 2026 test plans, sharing the exact same clinical judgment core and modernized activity statements. The differences life, breadth, and entirely within your specific scope of practice. It's the same blueprint style, just tailored to different professional boundaries. It all boils down to scope of practice, same style, different professional expectations. Again, they are polishing the edges, not moving the goalpost. Finally, what's the deal with health equity in the new content? This is where real action is. Expect to see unbiased care, strict patient confidentiality, and human dignity woven directly into the fabric of your test scenarios. Master these concepts and you will be gold. Alright, let's wrap this up now. With a quick recap, when it comes to the April 2026 NCLEX changes, remember this is a tune up and not a total overhaul. They aren't tightening the hit on the exam's difficulty. Bow-tie questions, metric questions, they are still part and parcel of the test. Where you will see a shift is navigating more gray areas and balancing multiple patients at once. When you are flying blindly with incomplete data, always let safety be your North Star. The question statement are simply getting a modern facelift to reflect today's floor reality, bringing topics like health equity, privacy rules, and work safety and advanced device monitoring straight to the forefront. So, what's your game plan for success? Don't burn the midnight oil. Try to cram for this exam. The April 2026 update is designed to reward nurses who can think on their feet, not just who memorize facts by rote. Train your eyes to spot immediate risk, and your brain will instinctively lean towards right choice. Whenever you are stuck, just ask yourself the golden question: what is going to crash my patient first? What will push my patient into risk? Or what action will remove my patient from risk or danger? What will keep my patient safe? And choose the answer that prioritize patient safety. At the end of the day, this 2026 updates centers on three pillars: patient safe care, clearer language and expectation, and rock solid clinical judgment. You have got all these tools you need. Now go out there and ace it. You'll pass on the very first attempt you try.